This is the case of Porker. Porker is a 2.5-year-old female intact Labrador that presented with a history of a left front limb lameness. The lameness is more severe after exercise. On physical examination, Porker demonstrates a mild weight-bearing lameness that localizes to the left front limb. There is equivocal evidence of pain during left elbow manipulation, particularly when the elbow is extended. The right elbow demonstrates no definitive pain. The shoulders appear to be normal, and the remainder of the physical examination is also normal. Our initial plan was to obtain high-quality radiographs of both elbow joints, as well as a CT examination of the elbows. Both a flexed lateral view and a craniocaudal view of the right elbow were obtained. Please note that the anatomic structures, including the medial epicondyle, the anconeal process, and the region of the medial cornoid process, appear to be normal and well defined. The elbow joint appears to be congruent, and there is no evidence of soft tissue swelling. A slightly flexed view of the left elbow, as well as a craniocaudal view of the left elbow, were also obtained. Note that the region of the medial cornoid process of the left ulna is slightly ill-defined where it extends proximally. The medial epicondyle and the anconeal process also show no definitive abnormalities. This is a comparison view of the left elbow on the left side of the screen versus the right elbow on the right side of the screen. At this point, we see that there is an ill-defined medial cornoid process on the left side compared to the right side. There is little to no degenerative changes associated with either elbow joint, and the remainder of the elbows appear to be normal. This is highly suggestive of a fragmented medial cornoid process involving the left ulna or left elbow. Because these changes are somewhat subtle and this disease is often bilateral, a CT examination of both elbows was planned. The image on your left side of the screen shows the localizer scout view from the CT examination. This shows the positioning used to obtain the CT of the elbows. The image on the right side of the screen shows a cine clip moving through both elbow joints. In this particular image, the animal's right elbow is on your left and the left elbow is on your right. This is a static image through both right and left elbow joints at the level of the medial cornoid process, cut in transverse orientation. The right elbow is on the left side of the screen, while the left elbow is on the right side of the screen. The radial head is demonstrated, as well as the ulna itself, and the region of the medial cornoid process. Please note that there is sclerosis of the ulnar trochlear notch on the left side compared to the right, as well as an ill-defined radiolucent line that can barely be seen but is present, associated with the region of the medial cornoid process. Also, there is roughening and irregularity of the medial cornoid process on the left side. The region of the medial cornoid process on the right side is well-defined, opaque, and shows no evidence of roughening. These are sagittally oriented reconstructed images of the right and left elbow joints. Again, note that the region of the medial cornoid process on the right side is well defined and opaque and smooth, whereas the region of the mediocornoid process on the left side is ill-defined, somewhat pointy in appearance, and radiolucent. These are two images, both from the left elbow. The image on the right side is taken just slightly more medial to the image seen on the left. Note that there is a defined free mineralized fragment associated with the region of the mediocornoid process seen on the image on the right side. These findings of a lucent, poorly defined mediocornoid process of the left ulna and sclerosis of the left ulnar trochlear notch is consistent with left-sided fragmented mediocornoid process syndrome. The right elbow was judged to be within normal limits, and both elbows appeared to be congruent. Arthroscopic exploration of both elbow joints was performed. The right elbow joint was normal during the arthroscopic exploration. The left elbow had a small mineralized fragment that was removed from the region of the mediocornoid process, and the region of the mediocornoid process itself was curettaged.